Hi, my name is Jonathan Soucek. I'm going to be a freshman at Cleveland State University in the fall. I was in the science internship program for nursing. My mentor was Mary Ann Hawkins, and part of my project is readmission rates of stroke and TIA patients. A stroke, also known as a cerebrovascular accident, is a loss of brain function due to a lack of blood supply to the brain. There are two types of strokes: ischemic, caused by a lack of blood flow or blockage; hemorrhagic, which occurs when the blood vessel in the brain leaks or ruptures. A transient ischemic attack, a TIA, also known as a mini-stroke, is when part of the brain loses function due to a lack of blood flow. Unlike a stroke, a TIA does not cause permanent damage. Patients with a history of stroke and/or TIAs are approximately 40% more likely to have another stroke. Controllable risk factors for stroke are high blood pressure, high cholesterol, diabetes, use of tobacco products, alcohol, and obesity. Uncontrollable risk factors include age, gender, race, family history, or previous stroke or TIA. The purpose of this study was to determine how many stroke patients were readmitted to Marymount Hospital and the factors that contributed to the readmission. A list was compiled of the patients whose primary diagnosis was a stroke or TIA. Data was collected for patients admitted between January 2010 and May 2011. Then a second list was created that contained all patients who were readmitted to Marymount Hospital within 30 days of their discharge. A comparison between these two lists was analyzed to determine if any stroke or TIA patients were readmitted to the hospital within 30 days of their discharge. EPIC was utilized to determine if there were any new findings, if the patient received a statin, or if they received an antithrombotic. Out of 387 patients who had a stroke, 44 were readmitted to the hospital within 30 days of their discharge. Of those 44 patients, 6 had another stroke. Out of the 44 patients that were readmitted within 30 days, there have been new findings of infarcts or tissue death in 25% of the patients since their stroke. A statin is a drug that is used to help lower cholesterol levels. Statin therapy has been shown to reduce the risk of recurrent stroke in patients who have had a previous stroke. "34% of readmitted patients did not receive a statin upon discharge from the hospital. However, 9% of the patients whose LDL levels were greater than or equal to 100 did not receive a statin upon discharge from the hospital. Of the 6 patients that returned with a recurring stroke, 4 of them did not receive a statin. At Marymount Hospital, 3 West is a certified stroke unit of the facility. Ideally, patients with signs and symptoms of a stroke should be cared for on this unit to ensure that proper treatment, care, and education is given. According to the graph, 29 out of the 44 were cared for in 3 West. Of the 6 patients that returned with a stroke, 4 of them were not treated in 3 West. An antithrombotic drug is used to help prevent blood clots from forming. These drugs help lower the risk of ischemic stroke by reducing thrombus or clot formation. As you can see, 5% or 2 of the patients did not receive an antithrombotic upon discharge. This graph indicates that 32 out of 44 readmitted patients received the proper stroke education. Note that 2 patients were terminally ill, so education was not given. Of the 6 patients that returned with a stroke, 3 of them, or 50%, did not receive any stroke education. My recommendations are: the multidisciplinary stroke documentation form must be completed and initialed to ensure that all stroke patients receive the proper education upon discharge. A follow-up call or appointment should be made to the patient. This will enable the patient to ask any questions while giving the healthcare providers the ability to confirm that the patient is following through with the physician's discharge orders. This may help to lower the risk of recurrent stroke and subsequent hospitalization. I'd like to acknowledge my mentor, Mary Ann Hawkins, Mariel Curtis Harris, Manny Economos, Rosalind Strickland, Nedra Starling, Marymount's Intensive Care Unit, and finally, the Cleveland Clinic Office of Civic Education Initiatives. Thank you.